Hi guys, and welcome back to the Courageous Parenting Podcast. We have a really special episode for you today. I'm joined by my good friend, Dr. Rosie. She is my chiropractor, and I just love her so much. She has offered to be here with me. We're going to talk about important conversations regarding subluxation, which is the need for chiropractic care. And many of you guys might not be aware of what subluxation is. We're going to talk out what that word means, but as well as maybe some issues that you've seen in some of your kids. I'll just label off a few of them. Maybe your kids have struggled with anxiety, fear, digestive problems, sleep. Maybe nursing's been difficult, or emotional issues, whether there's withdrawal or temper tantrums, things like that. All of that could actually have something to do with the need for some chiropractic care. And so we're going to talk about how God designed our bodies. And it's amazing. So I'm very excited for today's episode, and I hope you are encouraged today. Hey guys, excited to introduce you to Rosie. Go ahead and say hi.
I am honored to be here, and I really love Pastor Isaac, Angie, their family. They just love Jesus and love their hearts to do this podcast, and I'm just honored to be here to do whatever I can to impart whatever wisdom I have and have been given. Yeah,
it's been awesome getting to know Rosie. She has been coming to Rooted Bible Church for a while now.
Yeah, I started coming, I believe in the end of the summer, and just fell in love with the church. We passed by Horseshoe Bend and just saw this tent come up with lots of just people, and I'm like, I'm going to go there. And so
there's a lot happening. Yeah. God is good. God is good. He's definitely working. But it's been really neat to get to know Rosie. She has been such a blessing to our family and has been helping me and one of our actually a couple of our kids as well. And so chiropractic care, it's one of those topics that, some people are either into it or they're not. Is what it feels like, right?
I think a lot of times it's just misunderstood. And some of the times people just don't realize the value of your reasoning of why you're going. And many times people go for back pain and neck pain and don't really realize the philosophy or the principle of what we do. So that's the problem. Yeah.
It really is a problem. And just so you guys know, I just want to share a little bit about Rosie. She's a certified clinical chiropractic in neurology, right? Also has a certification in functional medicine as a practitioner, and she's a doctor of chiropractic. So Rosie has some interesting facts about her. You also have helped with the Olympic team.
Yeah,
why don't you share a little bit about that?
Since 2009, I started working with the USA women's wrestling team, and so have had the honor to serve for 3 Olympics: London, Brazil, and Rio, and in Tokyo, and it's been
amazing.
Really, really a blessing. Yes,
that's neat. It's been fun. And you also have done bodybuilding yourself, so you know a lot about working out and nutrition and holistic.
That's just
living.
a hobby that I love to do. But
yes. I love that about you though, because you've cared about the holistic part of how God made us, right?
Exactly.
Yes. And one other fun fact is that Rosie has twins.
Yes, and that they're God's miracles. Actually, my husband and I were having a hard time having kids, and I prayed to God and said, when you're ready, open my womb. But I gave him an ultimatum. I said, I do want twins, and I wrote it down and I journaled it. And little did I know when we got pregnant that, I was just excited that I was just excited we were pregnant. And lo and behold, 5 months later, they were premature, but the hospital, the doctor was there, baby A and baby B, and I'm like,
that's how you found out.
Yes, bring my journal. I put this out there. Wow. But it was God's gift, yes.
That's amazing. And now, as far as like a personal testimony goes, you've also had some health history stuff in your family that you've learned about and learned how to treat, and you've been able to help other people. And I know this because you shared personally with me, but you also came and did a whole workshop at our church on rebuilding the Holy Temple and shared part of that. Would you mind sharing briefly?
Yeah, like all of us, we probably had circumstances in our families where, either we get diagnoses of some kind. My mom, unfortunately, died from diabetes, and my sister at 47 as well, along with other things. But then my son got diagnosed about 5 years ago with type 1, and then here recently I got diagnosed. Unfortunately, it's a genetic not like type 2 where it's lifestyle induced. Type 1 is a genetic issue. But like I said, I think the circumstances have been a good thing because it's allowed me to not only gain wisdom what to do since I was a kid, but now utilize that to go help my family and the patients that we get to see. And that's where that comes from.
Yep. And I think that's probably one of the things that I've been most impacted by with you is that when you've walked through something, you're willing to share it with other people because it might be helpful to them.
You never know.
I
think God gives us things, I feel, for His glory, and we got to utilize that and view it as a thank God. Thank you, you gave me that. Yeah.
Yeah. Well, there's a couple topics we want to talk about for parents today that are specific that I believe for us as the Tolpin family, we've had our kids seeing cranial sacral therapists right when they were born. They've seen chiropractors. We've done lactation consultants when they had like a tongue tie or a lip tie rather than opting for the surgery. I'm not saying that's prescriptive for everybody, but that was what we chose to do. And we did the massage therapy and worked and fought for exclusively breastfeeding. And we had success twice on that where it was a severe tongue tie type of situation, but it was actually a chiropractor that was also a lactation consultant that was able to help me both times. And I know that for myself, being a mom, when you're in postpartum and you're wanting to nourish your baby and you're struggling with that, not only is there the physical aspect of the struggle, but there's the mental and emotional aspect because you feel like a failure as a mom, right? You don't know, why is this not working? And sometimes you get advice from other people saying, oh, well, you should just supplement. You got to give them a bottle or you got to give this and that. And that can be hard for parents to hear, right? And one of the things that I've personally been impacted by in my life,
Steve and I realized that we were getting too comfortable with the world's vision of how to raise our children.
What Angie and Isaac have done in creating this is literally phenomenal.
This program provided awesome scripture-based teachings and just some really great practical applications.
This class has just really rocked my world.
It has given me a vision for not just the different things that we might focus on as parents who are trying to raise our kids biblically, like how our kids are behaving or what we're doing with discipline, but also the things of the heart.
We now have a game plan to how we want to raise our children. We have so many answers to the questions that have been in our mind.
It's not just these hypothetical situations, or it's not just this, here's what I think you should do. It's, let me show you where in Scripture this is.
Do your legacy a favor and yourself a favor and just do it.
One of the best things that we've done this year, one of the best investments we've made this year, and I could not recommend it more.
We're no longer fearing dark days ahead, but we're so excited to raise lights, to be leaders for the next generation.
Has been people who've been in the same line of work as you that have been able to step in and be a part of our family team that are like-minded, they're believers, and they walk with you through it and they help you process that and make the right decision for your family, right? And so I'm excited to have you on because as a postpartum and childbirth educator, I did that for 10 years, obviously with Redeeming Childbirth and the Christian Postpartum course. I've worked with a lot of moms in this season of life, and there is definitely this vulnerability for moms when they're pregnant and they're postpartum, right? Where there's a sensitive vulnerability of desiring so bad to be a good mom. And then when things just aren't going your way, maybe you have a child that has colic and is crying all the time, or you can't get nursing to work and you're just beside yourself. You're tired, you're exhausted, you don't have the answers. The blessing can come from having someone who has been down that road or is educated to walk alongside you as a team member who believes the same things you believe and help you. And so I would love to start out let's talk about that birth stage, pregnancy, the importance of chiropractic and how it can help babies even and toddlers. And then maybe we can go into talking about that in regards to like children age, kids and teenagers, even hormones, and then even moms, because there are times when I know that for myself, just in the last few years, I started experiencing some perimenopausal symptoms, and really what it actually was my adrenals were out. And so getting chiropractic care that was regularly helping me with my adrenals and making sure I was taking the supplements that I needed to take to help support my adrenals, I was able to have those symptoms reverse. And that's not necessarily the case for everybody, but I really do believe that it was the care that I was receiving and the knowledge and the education about how nutrition plays a part and sleep plays a part and your supplements and your vagus nerve, right? So,
So I want to just, I am very impressed with your family and all the wisdom that you guys have and what you did for your family, because so many times people don't know,
that's true.
all this information of what to do, or even if we know, sometimes circumstances occur that it doesn't turn out as we wish, or, I wanted a natural birth, and that's why I didn't know there were twins. I went with a midwife, and we we're trying to be as natural
as possible.
So no ultrasounds, no nothing.
Yeah.
And so live and learn. But the reality is that, they were premature, like I said, and they were in the NICU for 2 months. I had an issue with whenever I gave birth, I had a piece of my placenta still within me, and I was bleeding, so they didn't know that. And
yes.
So the stress that comes with that, and not taking your babies home with you, and not getting that one-on-one time with them, and
the touch time,
everything.
all of it,
So it was not how I wanted it, but the stress involved with that, it created me not to be able to produce the milk, and it's a long story, but the reality, it still worked out. So I think sometimes we get too particular how we want it, caught up on how we want it, and we're just blessed that we got to take them home, against sometimes everything that the doctors were asking us to do, but that's another story. But the thing is that we got them home, but there was a lot of stress, not only with us, but I'm sure with the boys. They were and with beeping sounds everywhere. They were sent with home heart monitors, so there was a lot of stress involved. So as chiropractors, we knew the fact that this was going to alter the way they were going to then now try to breastfeed. So we had to calm them down. But from the very beginning, I couldn't at that point adjust my kids because I was not doing good. But I had a chiropractor friend of mine who flew from Montana to come and adjust my babies, and
that's neat.
At that point, my husband didn't feel comfortable doing it, and so he came to adjust my babies, and immediately their heart rates were so high they started to calm down. So I want to talk about what you mentioned, and this is where a lot of times moms don't realize the importance of the neurology when it comes to calming down your baby, your child, and how chiropractic has anything to do with the nervous system, because again, we've been taught that chiropractic is more for back pain, and why you're adjusting a baby, they don't have neck pain, they haven't
been in an accident, they haven't been hurt, injured in sports.
But they've been through birth trauma, whether it be, from a cesarean section or even an actual normal, God birth, because they have to pass through this canal. That it can be stressful. It's the best way to be born. You're pumping into the cranial, the cerebral spinal fluid. They're getting mom's bacteria that's good for them. And so there's so many things that are so good from a natural birth, but it's still a birth trauma. Sometimes they still get pulled, and so that immediately they get what we call subluxated. And like we talked about, some people don't know what that term is. And subluxation is just, I love this terminology with subluxation. It's sub meaning less than. Lux in Latin means light. And so there's less light. So I don't know if you knew that.
No, I didn't. That's really
God
cool.
put an amazing power in our body to heal, and we were fearfully and wonderfully made. And the first thing that develops as a baby is your nervous system, and that's where a lot of times people don't realize that for everything to function, your brain has to function at 100%. And when there's any interference from the spine, and that's a subluxation, a misalignment of the upper cervical spine, which is the most important area, that's when you get kids who start to have problems with what we call the autonomic nervous system. And this is the part of the nervous system that allows our body to calm down. And so babies, specifically at the upper cervical spine, can be subluxated or misaligned because of the birth trauma. And that's where a lot of times when we see babies with colic, or they're either fussy for some reason, or they're not latching on, they could be to the point where they can't get the sleep they need. And so we always start by basically examining their upper cervical spine to see if there's subluxations. And so this is where moms sometimes don't realize that a lot of this can be interference. And so God doesn't make junk, but if there's interference to the nervous system, it's going to not allow the body to function the way he intended. And so we always say, we move the bone, but God does the healing. And actually with a baby, their bones are not moving. They're not, they're not even one complete segment. They're in pieces. And so they're not fully fused. So an adjustment for a baby is not like an adult. And that's why sometimes there's fear with taking your baby to it. But just like the cranial work that you did for, and the massage, it's a very light tapping on the atlas or on the spine. And we do it through instrumentation or even with our hands, but it's very light, and it's mainly to stimulate the vagal nerve, which is the part of the autonomic nervous system that helps calm down our body. So we have two parts of our autonomic nervous system, which is the parasympathetic, meaning calming down, digesting, resting, and the fight-flight, which is the sympathetic nervous system, which is you're running away from a bear, the fight flight. So when you're under that sympathetic mode, then that's when you start getting some of the issues with sleeping and all the colic and things where your body's not settling down to digest. So we see that babies who get adjusted from the very beginning start to just not only function better, they feel better, they rest better, and that's how, with our babies per se, for me and John, we knew that chiropractic was going to be the first thing that we needed to do as soon as we got a hold of them. Yes.
Yeah. It's interesting because in our parenting mentor program, we go through these like basic nurture needs that parents need to be proactively engaging in fulfilling for their children, right? Like there's the physical of feeding a child, changing their diaper, keeping them bathed, clean, healthy, all of these things, having a roof over their head, right? And then there's all these other nurture needs. It goes all the way to the spiritual nurture needs, right? And we cover that more in depth, but one of the aspects that we talk a little bit about is this element of the emotional needs, and how as parents, we can't just assume that our kids are going to come out knowing how to have emotional self-control. And it's so funny how even like there have been moments, I'll be fully honest, there are times where I've been worked up or I've allowed a 2-year-old or a 4-year-old to get me frustrated, and I have to in that moment go, I can't believe this. Like when you look at it, when you set yourself apart and you look down on the experience, right, for a moment, you go, I'm really upset about what the 4-year-old has done or not done or said or not said or what they're, you know what I mean? And then I kind of feel a little silly. But it's interesting how even our immune systems can be affected, right? Because obviously we're connected to our children mimic us largely. So like if a mom is stressed out, one of the most common advices I give to new moms who are like, have you ever traveled with babies? Do you have any recommendations? And I'm like, well, yeah, don't be stressed out because they'll mimic you. There's this element of like, if your heart rate is elevated and you're holding your baby, they're right there, they're connected to you and they can feel that stress, and then they'll potentially cry and get stressed out themselves, right? But if you have an ability to calm down and you practice even like deep breathing, for example, you're literally teaching them, if they're on you, how to do that, how to practice that. But if you don't ever try that, then your child never actually experiences it either and learns how. And so there's this element of us as moms where we need to like realize what we don't know, have teachable hearts, be willing to ask questions, be honest about the struggles that we're having, and in the safe environment of a chiropractic relationship, being able to say, yeah, I can just tell my emotions are off, or I haven't been sleeping well, so I'm really exhausted, I find myself more irritable. That helps you as a chiropractor to know what area to even look for in the mom, right?
Yes, and so certainly our bodies know and sense so much, and just like animals, a dog can fear when they sense fear in another person. I really feel that's God within us, the Holy Spirit. That sense of fear, they feel it within us, and so when we talk to parents, it's never talking at them and getting mad at them, but they just don't realize that our children can sense, our babies can sense what
anxiety,
we're feeling, and they will respond to that. So their brains at this point, specifically children, which is kind of funny you mentioned, ourselves can get worked up
Yeah.
with the tantrums that our children are having, but we should be able to reason and logically understand that, being that we have our brain, prefrontal cortex, which is the front of the brain, that
formed.
creates logic and
Yes,
it has
yes.
wisdom. As a child, we're not developed there yet in the brain, so we come back more from the old brain, which is, not to talk over, but cerebellar, the diencephalon, which is the brain stem. And so that part of the brain is more primitive. It's about fight and flight. It's about protection, and so
Survival.
there's still in survival mode. And so that then develops as we grow, but through feedback. And so that's where with babies, you want that, like you said, that skin contact. You want that. That's how they feel that they're safe, because they're developing that wiring in their brain. So when we are being reactive when it comes to parenting, but even like in the sense of just trying to help our kids calm down, we have to be
Calm.
in a calm state, in a
Exactly.
parasympathetic mode. And so one of the biggest things is your breathing. I think that's what we always teach our patients, that whenever I'm going to adjust a baby and they're in that,
Stressed
if they're
out
an
mode.
older child, I'm stressed out. They're going to sense that. They're going to fear it. But if I'm talking to them and then just talking about, their day or whatever, then calming them down, I think that goes a lot better. But the babies are so smart.
They are so smart. And I think that there's also, you said something really important I want to highlight. You said they're developing. And I think that as parents, one of the things we talk about a lot here is wanting to equip our kids, right? We want to equip them for the uncertain world. We want them to be able to have emotional intelligence when they're older, which they're not just born with. But emotional intelligence is different than emotional self-control. And emotional intelligence is something that can be taught. But you have to be proactive as a parent, realizing this is something you get to teach your kids. But it's hard to teach something you don't know. It's hard to teach it if you're not living it, right? Like it would be hypocritical to expect emotional self-control if you're losing your temper and that sort of thing, right? And so
you take it back to the spiritual realm. It's not discipline, it's discipling. You have to
discipling them in how to respond, versus react, right?
Exactly.
And it's interesting. Over the years, I've been seeing chiropractors since I was 17, and I can tell now when I need to have an adjustment, like if I go too long without an adjustment, because I start experiencing a little bit more irritability in myself with other people, or I get more sensitive to like stimulation. I can tell when I'm like, even just being out and about here in the rural area, there's way less stimulants. But if I go into town and I'm around all of the EMF and all of the things, I come back and I'm just like, I'm exhausted. I'm like done, and I need that boost back.
And all of that has to do with the HPA axis, which is the hypothalamic, adrenal axis. Basically, your brain communicates your adrenal glands to produce cortisol, and when you're, on edge from stress or even
driving,
the foods you eat,
traffic.
Your brain is going to tell your adrenal glands to produce cortisol, which then will create that high sympathetic state. And so,
right. And then you come home and your kids want to hug you, but you're just like, ow,
on edge.
Ow, you're
on
like
edge,
on edge, right?
Yes,
and so one of the things that's been helpful for me is being able to have chiropractic care when I know, like I actually come see you on my busy day. You know this. This is Angie's day in town.
And you can tell she's a little on edge. And so we need to just calm down the nervous system.
That's right.
Again, the way you calm down the nervous system is by removing interference to the spine. But basically, it's you can do it even with your child, like hugs, touch, deep pressure. Specifically, when we work with autistic kids, ADD kids, that deep pressure allows that nociceptive. Basically, I'm not going to go over your head, but it allows your brain body connection to be calmer. So deep touch, even my breathing and your breathing have to be calmer. And I think that's what allows our body to just be in that parasympathetic state that we need to then start the adjustment and calm down for the day. Yeah.
It's funny because we have a puppy right now.
Yeah.
That's 7 weeks old. And we brought her home a couple weeks ago. And the first night at home, she woke up like 8 times and she was like, ow, ow, ow. whining all night. And she is her first night away from her litter and her mama, right? So nervous. And then the next night, it dawned on me. I was like, I'm going to bring her in her crate in my room so that she can be near me and hear me. I'm not kidding you. We've been doing that at night and then slowly been able to get her a little farther away. But if she hears us breathing, she calms down and she sleeps for 6 or 7 hours without having to get up and go to the bathroom, And so it's like, it has been a huge help. But I actually have read about how dogs with their owners, like they'll hear them breathing at night. They can sense when something's off. That's why they'll come and nudge people at night, like in their sleep, if they think something's off.
They've been in your womb for 9 months.
Or babies have,
Yes, exactly, yes. But I'm sure that their response to that breathing and that steady state breathing, but whenever yours goes up, I'm sure that they're also
and so it's really interesting how it's something that God created in his creation was my point, right? Like that there's this need for positive human contact and for us to... We've been using CTC Math for our math curriculum with our kids, ranging in ages 10 all the way through a senior in high school. Solomon, you're almost 10 years old.
Yeah.
And one of the things that I've noticed is all of a sudden you're an independent learner and you actually like math now, huh?
Yeah.
Recently when I wake up in the morning and I go, okay, we got to get school out. He's like, oh, I already did it. So Solomon, can you tell everybody why you like CTC Math?
I can just get so much done in such a short period of time, and it's so much easier than the other maths I've been through, and it makes it fun.
One of the things that we love about CTC Math is that the different elements of learning have been broken down into digestible learning increments that make it easy for kids to go through their lessons, feel like they've conquered it, and move on to the next. One of the things that I love as a homeschooling mom is that all of my kids can be independent learners, but then when they get stuck on something, I can sit down with them, easily listen to the lesson with them, and just help them navigate if they get stuck. But truthfully, this is one of the first math curriculums that we have used, especially for upper level math, where I haven't had to sit down and work hard with the kids. So if you're interested in figuring out if CTC Math works for you and checking it out, go to ctcmath.com. You've heard me talk about how we're members of Samaritan Ministries instead of having health insurance, which has been so helpful to our family over the last 5 years. But I wanted to share an update. They've recently launched Redeem Health Share, which we've now joined. We've also chosen to have Flex Share, which is an exclusive add-on feature where you can share for things like vision, dental, and preventative care. Redeem is a Samaritan Ministry program and has more program options to fit your budget and healthcare needs, all in a modern digital platform. Most importantly, Redeem upholds the same commitment that Samaritan Ministries has held for more than 30 years. Christians praying for one another and sharing medical needs together. Learn more at redeemhealthshare.org. Slow down and to just care for one another in a really intentional way. And one of the things that a lot of parents don't realize, because with the parenting program, we talk through the 10 steps of biblical discipline, we talk about discipleship, we're talking about all different topics in there. And one of the most common questions is, how do you get your kids to calm down when they're having a temper tantrum? And it's so funny when people ask this, they're like, really, that's what you do? But there are many different ways that you can do it. But one way that has worked for us is, for sure, no matter what, there's eye contact, whether that's me bringing a child up to my level or me getting down to their level, making that eye contact. One of the things that we've always used is we've had the kids put their hands on mommy's face, and that is an accountability for the busy mom to get down to their level, because obviously they can't reach you unless you're down close enough, right? And so, and a lot of times when I'm down there and they've got their hands on my face, I've got my hands around their waist or on their shoulders or on their face too, and I just say, it's okay, you can calm down. And it's so funny how quickly it happens where they're like, yes, and they just kind of start to calm down. And then it's like, if you need to have the long conversation with them and hear, oh, why are you upset? Like, they can't describe that when they're in the midst of being upset. It takes time to get them to calm down. And what are you teaching them? Like, the power of what you're teaching them right there is learning how to come down off of the intensity that they were at emotionally, right? And I think that one of the mistakes that we have as parents is assuming that kids just know how to do that because we do now, but the reality is that that's something that should be taught. Exactly. And that parents need to have that kind of patience and long suffering with their young ones. And as they start developing, their brain starts developing more, to have these as their like foundational things that they're taught even when they're 2. and 18 months and 6 months old, it's like they're right there, they're touching, there's this positive contact. It's okay, you can calm down, mommy's here for you. You know, you're singing to them, you're calming them down. That
even
builds.
Humming and like that calms
or in
them
rocking
down.
because
Yes,
you do
and
that when
rocking,
you're
yes,
when they're in the womb. They were used to you moving, right? And so that transition, that adapting to being outside mom when they're little, it can take time. And I think that we just need to have more grace for ourselves and not be so busy to get back on working out and doing this and doing my schedule. And, you know, it's like, no, you have a new baby with you, right? Yeah. But even with kids who, when they start getting, let's talk about kids that are a little bit older, maybe 6-7 years old, right? This is where they're starting to learn how to read at 4, 5, 6, 7. They're starting to do some school stuff, trying to concentrate. They can sometimes have a hard time focusing for a while, especially boys, right? And there's all different kinds of things that people can experience with their kids, but ADHD and ADD is just so wildly overdiagnosed today.
Right. Yeah.
As a chiropractor, do you want to talk about that a little bit?
Yeah, definitely. The number one thing that happens with autistic kids, ADHD, ADD, again, even seizures, again, is an overstimulated brain. And that can come from a lot of factors, not only the physical interference. And we know that sometimes, of course, toxicity, nutrition, inflammation in the gut. There's so many factors that need to be addressed. But the thing is with ADD and ADHD kids, what I see the best is that chiropractic, when we start stimulating the nervous system, you're actually sending input into the brain to then calm down, again, not through only mechanical pressure that they're feeling your hands. Typically ADD and ADHD kids, and even more so autistic kids, don't want to make eye contact. They don't really want to be touched. So it's a whole different dynamic with them. But again, once they gain trust in you just by those factors, but so many times it could be a multiple or multifactorial issue. And so this is where we never neglect all interferences, physical, chemical, emotional, like we talked about. They're all so important when it comes to chiropractic. I think that definitely one of the biggest examples I have is we had a child who, again, as soon as he came into the office, it was too much sensory input. And so he went and hid under our desk in one of the cubby holes. And so again, sometimes the biggest thing is just learning that we need to be aware of just the sensory input is going to be so huge for them. But as soon as we shut down the lights, shut down the TV, shut down everything, he started to calm down, and we just started to talk to him. And so it's so important to understand these things, that they're just they're bombarded with so much right now, specifically now with EMFs that are another factor too.
And all children are going to be affected by that at some level, to some degree, right? And so learning the importance of how to eat healthy and have nutrition, and trying to choose better choices, help your kids to learn how to make better choices so that they're not exposed to that stuff up close and personal as much as possible. But then also seeing the difference between a kid when they are and when they aren't. Like that can give you a lot of insight as a parent, right? Like I even notice it when I go into town, if I let the kids watch stuff on the TV, like if I let the older siblings let them watch a movie, I come home and the kids are just like, they're almost bouncing off the wall. It's like, why did you go outside, run around the house 20 times? I don't know. Like, you need to get physical activity, breathe some fresh air. Like, no, this has not been good just sitting around, right? And so there's an element of like being aware of what is causing the attitude, causing the different behavioral symptoms that you're experiencing, right? And I think that a lot of parents who are maybe less educated or aware that the vagus nerve and the nervous system has something to play with this, as well as toxins and nutrition and all of the things that we talk about. It's a really big deal. And so when you don't realize that, then you can get in this mode, especially as Christian parents, where it's like, oh no, I just need to discipline them, or I just need to train them in this. And there's a real fine line. Like as parents, we definitely are called to discipline our children, to bring them up in the admonition of the Lord, but it also says instruction of the Lord. And there's this element of like being aware of how God made us.
Exactly.
And being willing to recognize when something is not necessarily willing. I think a lot of parents are willing, they just don't know, right?
That's the problem, that we just, like we talked about with chiropractic, they don't know what they don't know, and they don't know.
Yeah.
I mean, I think that a lot of us have never been told, and there's not a book, I mean, that tells us specifically how to do it.
If your kid is dealing with this could be
but
this.
This is where this kind of a podcast is amazing in the fact that it ties in not only, of course, the spiritual side to disciplining your kids the way God intended it, but it also brings now with being relevant to our culture right now, with it's just go. It's a go society, and it never ends. And then now kids with cell phones and iPads and so much coming at them. I think that we're creating these kids who are just so toxic, just with screens and information input, that we need to go back and learn how all of this has to do with the way they now respond with their, whether even with depression with kids, and I see this in
this is a big deal.
Teenage years more so, but even in like you said, not the toddlers per se, they're more still reacting with tantrums, but once they start to realize this is stressing them out, the adrenal cortex has produced so much cortisol that now their brains and their inflammation in their gut is not creating the serotonin to kind of calm them down, and now they're depressed because they have lost the ability to produce the serotonin in their gut, and so there's so many factors. I don't think that we should just pin it down to one thing. I think it all matters. And,
it does all matter, which is why, in the Parenting Mentor Program, when we're talking about the nurture needs and parents will ask about certain things, I have a personal testimony with one of my kids, and I'm not going to tell you which one it was. There was 9, so good luck guessing. You would never guess that this child struggled with temper tantrums when he was little, but it was hard. And I remember going and seeing our naturopathic doctors, a functional medicine doctor as well, and he did intolerance testing to find out what was wrong with him. And there was this process of there is clearly something else going on, because it was hard to make eye contact, calming him down. It was not the same as my other children, right? There was definitely something irritating him, and it wasn't just fixed with chiropractic. It was like multiple things. It was chiropractic and nutrition, and there was this element of okay, let's look at his lifestyle. What are the teratogens that are potentially irritating him right now? Right. And let's start knocking some of those out and see how his body responds. Let's see how his emotions respond. Let's see how he responds to you, right? And within 6 weeks, he became a different kid. Totally different kid. You would not even guess that he was having the issues and the tics and the different things that he was at the time. And I look at that and I just am amazed, because it could have easily been, if I wasn't willing to go in for something that's as simple as a temper tantrum. Right? And I'm not saying go to Western medicine doctors. They're not going to be much help. But I know that for myself then, I was in this, I was in the process as a young mom of we have to totally do everything different than what we know. We need to eat healthy. We need to, it was just a complete life change. And I knew I needed mentoring. I needed discipleship in a sense. And so finding a doctor that was a believer was a huge step for me. And I know that you're a part of a network that I think would be helpful for anyone who's in the United States, at least, and Canada too, maybe.
Right.
Can
so
you share
we're
about
part of a
that?
network called Max Living. And with chiropractic, like I said, there's the chiropractic that's more pain relief versus corrective, and our approach with Max Living is the philosophy, I think the principle that God put that power in our body to heal, and health comes from the inside out, not outside in. So that right there, that it comes from actually above, down, inside out, from God. And so down through the nervous system, and so clearing the nervous system, but with
so it can communicate,
exactly,
right?
to communicate at 100%. So when there's interference, it doesn't allow that brain-body connection to work. But we look at the lifestyle, not only, of course, the principle of chiropractic first, trusting God first, but then the nervous system, but also the lifestyle, nutrition, toxicity can be interferences as well that affect the way body functions. The fact is that we know that God didn't make these things, and to put that in our body, and then the way the body and the nervous system responds to that is huge. So educating patients in our office, with Max Living offices, is that principle, because sometimes people think that we just are anti all this medicine, and yes, there's a time and place for stuff.
Yeah.
Like I say, sometimes people, need these things, but we need to understand the principle that outside in never works.
Mm-hmm.
And that's why you get the big idea.
Yeah.
And the big idea is removing interferences, allowing the body to work the way he designed, and we trust in that all the time. And so even a simple fever, and I even go to the extent of saying even cancer. And then sometimes people say, what do you mean? It's like cancer's the body doing the
what
right
it's made
thing
to do
at the right time for the right reason. And then that goes a little deeper in our paradigm, and I think that we need to baby step, is sometimes the parents don't get the bigger picture. They don't realize why they have to kind of start learning how the body functions, trusting in that power that made them, that heals them, that's never left them until they go up to heaven. And so that's where
it's hard to discern for parents, right? You love your child, you maybe get a diagnosis of something that's creating fear naturally because you love them, right? There's the unknown, and then depending on who your doctors are, you're going to be fed a certain form of information, right? And so,
and this is where I love this, because you have people that you surround yourself with. When you're alone on an island and you don't understand the body, you fear. You're going to, and that's so natural. But when you anchor to groups like this, or women that you trust and that can guide you, and this is what I love about what you guys are doing here at our church, and then for everywhere, because this is what women need and parents need in general.
It's empowering them to say, hey, listen, Mom, if you have a gut instinct that something's wrong, listen to that gut instinct. You know better. Even if you were to go see a Western medicine doctor and they're like, oh, you're crazy, you don't know what you're talking about, don't stop there.
And we got to also include dads, because if it's not completely yoked, you're going to have one side still not with you. And so this is where all of this is so needed for both to coincide and trust and know
I'm so glad you brought that up. I mean, alignment in marriage, it's huge for every topic that we could talk about, but when you're making hard decisions about your child's health, when you're pursuing a specific kind of treatment for a kid, it's if there is not alignment in the marriage, it's a lot harder. It's complicated. Sometimes the kid doesn't even get the treatment that they need. Right.
Well, we even saw it with the whole COVID. There was an alignment in marriages with that paradigm.
It's true.
It was
the enemy
breakup.
wants
and
to
so
divide.
We have to make sure that we're fully aligned. And I love it with chiropractic is that, this is where John 15:4, I am the vine, you're the branches, because it's that alignment that you need, and he's the healer and we align. It just
that is so cool. I've not heard that analogy from a chiropractic perspective.
Yeah,
what
so
you do is you go to a
is
line.
the nervous system, and the branches in the fruit. And so to me, that's why it makes so much sense to me, that verse. It's like it's about aligning.
Well, on a really practical level, I think that what's helpful, a lot of the different chiropractic offices I've been in have the same chart, right, of the spine with the subluxation and the different points and how it affects different organs. It affects your digestive system, your small intestine, your sexual hormones.
And those are the branches.
Yes, exactly. And so I think that for the most basic teaching of this is when something is out of alignment, it affects that area and the organs that talk about it, right? Because the spine is really there to protect the vagus nerve, which is the autonomic nervous system that connects from the brain, and then it speaks to all of the parts of our body, like every part of our body.
You're a chiropractor, you have no idea.
This is the part that just makes me, I get so excited. Like, I understand that, but one of the things that's been frustrating as a mom when we were, back in the day with Western medicine, if you even brought up a question regarding this, it was like, oh, that's hocus pocus, or that's not, I don't know, and
it's too simple.
But for them, it's also, they aren't educated in the autonomic nervous system in the same way. They have a totally different paradigm and indoctrination of what they're learning.
Right.
And understanding the wholeness of how God made us means that we're going to also understand not just the organs, not just the skin or the bones, but we're going to understand the autonomic nervous system. We're going to understand the skeletal system and how it works together with the autonomic nervous system. And so, this, I think as a homeschool mom, I get kind of nerdy about this because that was actually the thing that redeemed part of my education with biology. I was never really good at it, but then when I started teaching it, I got so excited because I was Dr. Mom, and I was, trying to heal kids naturally as best as possible and making my own supplements and things, and then here I am teaching the human anatomy, and I'm like, oh, I just got all nerded out about it. I was like, this is so cool.
But the more you understand it, the more you are in awe of God's
Totally.
wisdom. And like he said, you're intricately woven. I formed you in the womb, and I just, you know, you're
But
just
then you
in awe.
understand that it is connected, right? Like the ability for your hormones to work right when you're trying to go to sleep, for example, right? And so then here's the deal. How does that translate into parenting? You start operating with a little bit more grace for your kids, and you change your expectations of where they are. Like when you were saying, when they're little, they aren't developed. They're developing every day a little bit more. So when you are in this mode as a mom to be intentional, or a dad to be intentional, and to be equipping them to be helping with the development, then you're going to parent in a way that actually does help them to develop even faster, actually.
Right.
And it's interesting because over the years, the kids, even when they're at a young age, like their ability to talk and make eye contact with people are oftentimes like, wow, he just talks so well. Like, and he was barely 2 years old. And I'm like, well, he has 8 older siblings and 2 parents that are with him like all the time.
Yeah.
You know what I mean? And so as far as communication goes, he was around a lot of communication, a lot of hands-on.
Exactly.
And it changes a person, you know? And it's really a beautiful thing to see, because I just envision who Xander's going to be when he's older, being the youngest in such a big family, you know? Well, this has been really good. I would love for people to have a website where they could find more about this.
Max Living, it's Max, M-A-X Living, maxliving.com. Our, again, we're all Christian-based chiropractors who have practiced what we call the 5 essentials, which is, again, removing interference to the nervous system, to your mind, and putting, of course, God at the center of that. And nutrition, toxicity, exercise. Those are the 5 foundational keys that we all teach. But the beautiful thing is that we all do the same thing, so you'll experience the same thing that she's experienced at our office. And so you can go to find a doctor there at maxliving.com, and you won't regret it. And they're in Canada, they're in the United States, and even Mexico and Puerto Rico. And so we're excited to.
Well, I'm excited about that, because I think that, well, I know from, especially during COVID, when we were recommending like build your team, have healthcare professionals that are like-minded, because we saw people pushing stuff that was not in alignment, right?
And we actually just did that seminar, the Biblio Diet.
Yes.
So Josh Axe, and many people know Josh Axe and Jordan Rubin, but Josh Axe was a Max Living chiropractor. He was a chiropractor, and he's a great friend of mine, and wrote this book. But the same, principles, if you do know him, he has a crazy good website that most people know, but so it's nice to have that confidence that he is also part of Max Living. So
yeah, that's really cool. Well, I know that you guys are probably encouraged to hear a little bit about this, curious where to find a doctor that maybe could be on your family team, and so go to the website maxliving.com and find someone in your area, Lord willing. And I just want to encourage you guys at the end of this, like if you're dealing with stress as a mom, maybe you have some symptoms of things that you're struggling with, it is important that we take care of ourselves as moms, because we need to be able to take care of our children. And I know that for myself, I used to struggle with the mom guilt when I would go and take time to go to a chiropractor appointment or whatever it was. And I realized that that was actually just thoughts that I needed to take captive, maybe even from the enemy, and that I needed to put my health first. And then when I was able to do that, then I was able to be a better mom, see the needs that were in my kids, and also get them help too. And so I think that there's something really truthful about that whole concept of put your oxygen mask on first before you put somebody else's on. And part of this is just understanding that there sometimes when your kids are melting down, there's more to it than just being selfish. And sometimes it is selfishness. And so as a mom, take the rose-tinted glasses off, like we love to say here, and let's be honest about where our kids are at. Are they manipulating, or do they have a real issue potentially in their gut or in their autonomic nervous system? So yes. Well, thank you guys so much for joining us today. And if you need any notes at all about today, website, that kind of stuff, you can find it at courageousparenting.com. And of course, everything for the ministry is at becourageousministry.org. Thanks again, and we'll see you next week.